Good afternoon. Today is the 15th December 2017. My name is Michael. I'm from Israel, 10,500 miles away. I've been fortunate enough and no less privileged to have been introduced to Dr. Lonnie Herman by another patient who had an identical condition to that from which my wife suffers, and he had cured that. As a result, my wife brought me and subsequently my oldest daughter and two of our grandchildren to be treated in this absolutely astonishing manner by Dr. Lonnie Herman. Having endured decades of conventional medical treatment for a plethora of serious conditions, including the current autoimmune disease from which I suffer, it has been more than refreshing, understated, to meet a person like Dr. Herman. I say like, frankly I think he is unique, so I can't even compare him. I mean this very, very sincerely. I just want to focus on one feature of many that he has manifested for me with absolute unequivocal success and changed my entire lifestyle and my entire approach to my chronic medical condition. Until 5 months ago, I was suffering from very regular urinary tract infections. They caused usually hospitalization, huge doses of intravenous antibiotics, and left me pretty weak on an ongoing basis for several years. When I met Dr. Herman, one of the first ideas he presented, of many, was to relate the condition of my teeth and gums to those areas of my kidneys which were causing these infections. Miraculously, I would say, but with his great incomparable skills and expertise, he was spot on in identifying the correlation between the infected teeth and gums and the infected renal areas. As a result, he recommended me to have 5 extractions of the problematic teeth and subsequently 4 crown replacements. And since then, the last 5 months, I have not had a single recurrent urinary tract infection. I've been reborn in this respect, and I know there's a lot more that we are in the middle of. I would like to say to Dr. Herman,
I'm sorry, before we say that, I'm sorry to get you off track, but it wasn't just only the extraction that removed the infection. There was a piece that we had to get done in order to get the other pieces done to relieve the infection from the bladder.
Correct.
And the kidney. Okay.
Of course. It was part of a process with the energized waters, the vials, the ongoing in-depth treatment, the protocols that I and separately my wife for her condition have followed absolutely with religiously and meticulously.
And with ease, right?
And with total ease. There's been not the slightest bother to either of us from following these protocols. Quite the contrary. They've become a natural part of our daily routine, and we travel with them because we are frequent travelers. We have no problem in taking them wherever we are and keeping them fresh and unspoilt. Mm-hmm. What I wanted to say to Dr. Herman, if I may, is it's not only the medical, professional, non-conventional treatment which he administers so specially. It is the human feature that he applies in dealing with Sharon, my wife, and myself, my daughter and my grandchildren. He has that inimitable knack of getting through to us at the personal, empathetic level, which enables us to respond all the better, so I earnestly believe, to the treatments that he is administering for us. I'm sure that that is a contributing factor to why we are recovering so remarkably. And I look forward to continue our journey together until you have exhaustively applied every possible remedy. And I know how keen you are. You are as keen to cure us as we are keen to be cured. And that is the partnership we have with you. Thank you very, very much.
You're welcome. Thank you. Excellent. If I can also say, I just want to point out a couple of, I appreciate that. And just for you, for years of the urinary tract infections, I mean, it was, how frequent were your trips to the hospital for these urinary tract infections?
More than once a month, very often.
And how many days did you have to stay in the hospital with those
very often,
procedures?
Anywhere, never less than 4 to 5 days, very often 16 to 18 days.
16 to 18 days in a month in the hospital,
yes,
dealing
yes,
with the UTI.
Regularly.
Incredible.
Because the hospital, in their conventional approach, found it very difficult to identify the exact antibiotic that they were seeking to give me, and very often they failed, and it was trial and error, and then there were fungal infections, and they didn't get it right very often, and that was extremely frustrating and did me a lot of harm.
Yeah.
So being out of that regime, thanks to your absolute incredible skills, is a huge breakthrough in my life.
That's awesome.
Thank you.
May I share one other thing about your own personal experience with your condition, if I can? Your condition is actually, which is a rare condition, which is mostly not known to many people, but the diagnosis is diabetes insipidus. And this diabetes condition, which people don't understand, but diabetes is not a blood sugar disorder. Diabetes mellitus is the blood sugar disorder. Diabetes insipidus has nothing to do with blood sugars. He has a normal blood sugar. He's diabetes. It's because of a disorder with the kidneys and where the brain relates to the kidneys. And so the body is not able to regulate the fluid removal through the kidney, through the bladder, and out to the body. So you've had, for how many years, for the diabetes condition, how many years ago were you diagnosed with this diabetes insipidus? Not a blood sugar disorder, but diabetes insipidus.
34 years ago in 1983.
1983. And you had done, they provided you, because they could not regulate your kidneys, and you're on a blood pressure type of regulating hormone, vasopressin.
Vasopressin, I take it 3 times a day.
And how many
with various
years?
doses.
How many years?
34 years.
34 years with that. And have they been able to regulate your kidneys?
No, unfortunately.
Have they been able to regulate the kidneys?
Unfortunately, the kidney condition worsened, but it only manifested its deterioration 5 or 6 years ago when I was diagnosed with an autoimmune disease known as retroperitoneal fibrosis, IgG4 related sclerosing disease. And that was when I reached, if you will, the pinnacle of my renal problems. But prior to that, it is acknowledged that this fibrotic condition had attacked my pericardin. I had pericarditis very, very severely 9 years ago. I had the window procedure to connect a tube from the pericardin to the lung to enable the pericardin to drain. And it's part of the same features. And as I think you've established yourself, it seems to be commonly accepted that the diagnosis in 1983 of DI, of diabetes insipidus, was already relating to this IgG4 autoimmune condition, but it wasn't yet known in the world. It was only diagnosed for the first time in Japan about 10 years ago, I believe.
So a very rare condition.
Very rare.
And you're, with the medications, they have not been able to really, you're still alive, so we appreciate that, their efforts that they put in with you, and these doctors who've helped you, these specialists, or nephrologists, urologists, and so on, and cardiologists, and whoever has been on the team to help you stay alive and function. But they actually realized that with the medication only, it was not doing enough. They had to put in the bags.
Not only that, Dr. Herman, the essence of my daily survival protocol is to avoid the kidney function worsening by the slightest, which could bring me onto dialysis. And that is my fight until hopefully you are going to cure me, and I have every belief that you will.
Well, I'm not going to cure. Your body will fix itself. So me finding the causes of your condition with very unique ways, and getting it fixed. But you've actually had, if I could share something even a bit personal, if it's okay, of the attachments that they've had to put onto the kidneys to these nephrostomies to be able to evacuate his kidneys, because even the medication to try to regulate his kidney function is not doing it, and they say that your kidney is way down in function, and they've got these nephrostomies, these bags to collect the urine out of the kidneys for him. So the work that I'm obviously, to even see this point where you're back from 10,000 miles away, because you have seen some improvement, to see no more UTIs is just brilliant there in and of itself.
Just outstanding, just outstanding. And just a word on that, the nephrostomies, I live with them, I manage with them, but they are very burdensome and acutely bothersome. Starting, if you will, at the end, they have to be surgically replaced every 3 months under local anaesthetic, and they have to be emptied every few hours during the day, and the bandages have to be replaced every 3 to 4 days, sometimes less. Thank God I'm blessed with my wife, who's a wonderful partner and who deals with that. But it's a very burdensome, acutely involved modus vivendi.
Yeah, so there's all of that interference in its life function, and with conventional work, it just hasn't gotten to the place that we're getting you, and that I plan that you're where we're going, as you just said before. So I appreciate your time, I appreciate your effort.
Thank you.
And your time with us and your belief, and it all just makes sense, doesn't it? It's just such a beautiful insight to the body.
Sharon and I and my family are truly, in an unlimited way, grateful to you for your expertise, your humanity, and your dedication to us. We're very lucky and very privileged to be treated by you.
Thank you. I appreciate that. That's beyond out saying there. So thank you. We're working with his wife for her brain fog is gone as well, that she suffered for years with that.
Lyme disease.
Chronic Lyme, brain fog is gone. And so I appreciate you sharing this. And we've got to, you'll be able to call my clinic. I'll put the number at the bottom of the screen. I'll put up the email for my clinic assistant to schedule appointments. I am making another video about some findings about this gentleman, Mr. Shine. I'll put up some findings in the exam, nothing too personal that he hasn't already shared of what his condition is, but also with some specific unique exam findings so you can understand the depth of penetration, the depth of understanding of the tissues, and the way that diabetes insipidus and kidney, which they told you, I'm sorry, before we even end, how the kidneys are not working, but they have offered you or not offered you dialysis.
They've not offered, they've left it on standby as recently as 6 months ago, when I was having the quarterly nephrostomy changed. The invasive radiologist said to me, I'm a miracle man, and by all statistics I should be in dialysis. And of course I'm fighting that, and now you are a really huge ally in that. Huger than they can understand. So dialysis is not being used, but it's still, why even get to that, having that crutch about dialysis is not the thing.
Can I just say something? I'd just like to one of the other things that I think you've missed with your kidneys is that the IgG4 related sclerosing disease has caused a lot of scar tissue around the kidneys, and this is preventing the kidneys from draining properly. And this is one of the reasons he has to have the nephrostomes on. So the IgG4 has caused the sclerosis around the kidneys, which has decreased the kidney function. And in addition, he has diabetes insipidus.
So with the IgG, now I'll just say that, even though which will merge us in, with the IgG4, just to point out, is that why is the body's immune system attacking to scar the kidney? And what did I say that we found in there today? Scabies infection. You've got chemicals in there. We've got infections from the mouth that are in the kidneys. The body scars the tissue because its immune system is attacking. Your immune system is not your enemy. Your immune system is not your enemy. It's not autoimmune, the body attacking the kidney. It's because the immune system is in there fighting what's damaging the kidney. So in the end, it's causing that excess of that scar tissue to develop. That's what that is. The fibrosis, IgG4, sclerosis of the kidney is because both, is because your body, your immune system is doing the job. Your soldiers, where you live in your country, your soldiers are there to protect the citizens, not to hurt your citizens, right? So your soldiers, your immune cells in your body are attacking the invading chemicals and infections in those, and they're causing the damage at the same time because it's not able to get out. Your immune system soldiers are not able to get that stuff out of there, and especially because from your mouth it kept dumping in. Yes. So we're shutting down the fuel on the fire, as well as cleaning up the fire and the effects of the fire. Thank you for your sharing.
Thank you.
I appreciate it.
Thank you.
Okay. Yes.